Hello, my name is Valerie Cordero, and I'm co-executive director of Families for Depression Awareness. We help families recognize and cope with depression and bipolar disorder to get people well and prevent suicide. Today, we are examining representations of postpartum mental health in movies. The movies we are discussing are A Mouthful of Air, Tully, and The Lost Daughter. A few things to note before we begin. The panelists and I will talk about major plot points for these movies. If you haven't already seen them, you may want to pause this recording or come back. If you don't want any spoilers, save the page. And after you've seen the movies that you want to see, you can watch our discussion. But we will be discussing major plot points and spoilers. So just want to make you aware. I also want to give a trigger warning. These movies do discuss perinatal depression, trauma, and suicide. So we're going to touch on each of these issues in our discussion today. And if any of that is too upsetting for you, we again invite you to either come back to the recording or decide that for your own health, it's not good for you to hear it. But we hope you will stay. It is now my pleasure to introduce our panelists. Susan Weinstein is my fellow co-executive director at Families for Depression Awareness. She has been with the organization since 2012 and is an invaluable voice of lived experience for our organization and programs. Hi, Susan.
Hi, Valerie. Thanks for having me.
Thank you for being here. We have a special guest panelist who's with us today as well. Her name is Shamika Tumblin. Shamika is passionate about creating change within communities of color, aiding in increasing access to quality care services within the mental and behavioral health fields, and ensuring through sharing her own story that no one feels alone in their healing journey. She is a public health professional and licensed marriage and family therapist whose work centers on birthing communities. Her work with maternal child health on the local level led to her pursuing becoming a full spectrum doula and now advocating for maternal health nationally. As a Black woman navigating the healthcare system, Shamika has experienced firsthand both biases and racism, which, along with other life experiences, resulted in her creating Positively Meek. It's her platform for sharing resources and providing education around mental and reproductive health, as well as opening up about her own life experiences. Shamika, welcome. So Shamika, you also have a role with Postpartum Support International. Would you like to tell us a little about that?
Sure. So I excitedly have been appointed to the role of our Postpartum Support International Alliance's professional development programs manager. There we go.
That's awesome. I know it's a new role, and that's you're gonna have. I think you're gonna have a great impact there.
Thank you.
So we're so excited to be discussing these movies. The chat is open. Feel free to add your comments if you've seen the movies and you have something to say, or you have a question for any of us. Feel free to use the chat because we hope to have a really lively discussion. So the first film we are going to discuss is A Mouthful of Air. Julie Davis writes best-selling children's books about unlocking your fears, but has yet to unlock her own. When her daughter is born, her trauma is brought to the fore, and with it, a crushing battle to survive.
I made it. Can you just tell me a little of the story?
Okay, the story is called Pinky Tinkerbank Saves the Stars. Pinky Tinkerbank and her mommy were best friends.
Morning.
They went to the park together, played dress up together. Then one day, Pinky's mommy got sad. Every night before bed, Pinky would wish on a star.
Hello, Miss Davis. Can you tell me what happened?
But little by little,
Julie, hey, it's okay. It's okay.
the stars were starting to disappear from the sky. There was nothing left for her to wish upon.
What if you stop loving me?
I'm never gonna stop loving you.
You can do this, Jewel. You can. I was walking through a world that was black and white. Now I'm just starting to see color again. Sometimes the stars are blocked by the clouds. But even if you don't see them, they're always there.
So the main character of this movie, A Mouthful of Air, is Julie. She has a history of depression. When the film opens, she has already made a suicide attempt alone in her apartment with her 1-year-old. As the film continues, we watch the aftermath of that suicide and the hurt, anxiety, compassion, and anger that is felt by her loved ones around her. We also are able to see her interactions with medical providers, her tense relationships with relatives, and her deep desire to be well for her family. Susan, one of the reviewers, or one of the people who saw the movie, somebody who's just a viewer, wrote this comment. I suffered from perinatal depression, and while I never attempted to take my life, the thoughts were there at times, and it was overwhelming fear of failing as a mom, fearing accidents happen, and the future, and so much more. To see a film beautifully made that opens up these isolating and irrational feelings is received with so much love. How did you respond to the movie, Susan?
Well, one thing about all these movies is the amount of baby crying was overwhelming. And so it really puts you in the moment for all of these women. But I actually had a really hard time when I started the movie because the isolation that she was feeling was so brilliantly depicted, and it was just relentless. And definitely brought things up for me, even though I had good support. But there's just a lot of layers in this movie in terms of different relationships, very difficult and strained and fraught relationship with her father that you only see a glimpse of, her mother having kind of weird expectations, but trying to be supportive, her husband at first seeming aloof, but really coming through in a surprising way for me. But there were some scenes that really rang true for me. But I mean, overall, the response at the end is just that, you know, why couldn't they find an effective treatment for her? And I know part of it was, you know, when you're dealing with depression, it's really hard to say that you need help and to admit that to yourself and to others and face the, you know, you think that there's going to be disappointment among other people as opposed to, you know, relief that you're accepting help. But there was a lot of emotion for me, for sure.
I also found the movie to be extremely emotional, as someone who has had children and has a glimpse of those feelings. And it was a really accurate portrayal of what it can be like. And not only that, but she's managing so many emotions. She's managing her own emotions. She's managing motherhood. And so children, we find out in the movie later on, she gets pregnant with a second child, which was unexpected and really unadvised by her mental health professional, just because her mental health was not yet fully stable, so close after her suicide attempt. And then you also see her interaction with her different family members, as you alluded to, Susan. And so I think it was a great portrayal in terms of accuracy to the feelings that women who are experiencing postpartum depression may have. It also showed the complexity of how you can try to hold your own emotions, but there's so much going around. She was not having all of those experiences in isolation. So she not only had to deal with her depression, she had to deal with the expectations of her as a mother, the expectations for her as a wife, and even as a daughter. So that really rang true. I also mentioned that there is a depiction of her mental health professional played by Paul Giamatti, a great actor. And he's keyed into what's going on with her, and does try to provide guidance. And he reads a lot. He talks about a lot of poems, which to me was a little bit annoying in the movie, but they were trying to give her some inspiration for how she needed to reframe looking at her life. But Shamika, as our licensed mental health professional on this in this discussion. What do you want to say about how mental health professionals, and sometimes even OBGYNs or these medical professionals around mom, what their responsibilities are, and how what they should be looking out for women who may be experiencing postpartum depression?
Hey, yeah. So I think one of the key things, and you both have touched on it, a big one is, especially whenever I'm even from intake on with a client, asking about the support system is key. Understanding who's there for the client, even beyond when they're sitting in a room with me, because what we do happens in a bubble. And whether we're talking about postpartum work or just like mental health work in general, what you do in your therapy room is supposed to be practice for what you're going to face in life. But if I don't understand who I'm helping you to practice to navigate those waters with, then I'm not effectively helping you to actually be able to handle what's going to happen when you're no longer sitting in front of me. And of course, we don't want you to become dependent on your healthcare provider, but also we need to know who may be around that you are dependent upon. Because what if they're not giving you, what if what they're doing is actually leading to those thoughts of self-doubt, or constantly questioning yourself, or maybe even some of those intrusive thoughts that you're having because you're constantly picking up what's happening in the environment around you, and you're constantly wondering how people are either seeing you or misreading the cues from the environment now, and taking it as though you're not doing something that you're supposed to do. And one of the things that happens a lot, especially among the birthing community, is this idea that there's a switch, like you have a baby and you like, because you had a baby, you're supposed to know how to be a mom. For anybody that's listening, that's not what happens. Like, and please know that that's okay if you're someone who's like, I need help, I need resources. There's no manual for being a parent or for even like having a child, like even the birthing process itself. Um, and so when Susan mentioned that, like just her support systems, and then also talking about the husband coming through in an unexpected way, that happens a lot in terms of the person that you least expect being the person that may step up and be like, yeah, maybe I'm able to pick up on something the others aren't, maybe because I treat you differently, and not in a bad way, but in the sense that maybe I see your independence differently than everybody else around us does. So I may be able to tap and push you in ways that others can't. And then as far as things that I think we should definitely be doing, when we have screenings, if we know individuals have a history of depression as well as other mental health disorders, being able to have open conversations and know when they're planning to even start trying to have a family, so that we can have those open conversations about things to be on the lookout for, as well as open the door for them to feel comfortable to tell us as soon as they feel like something may not be going the way they thought it should, or they're having feelings, without being too graphic, they're having dark emotions, and they're like, hey, I need to tell you now, I just found out that conception worked, but immediately on hearing that I'm pregnant, I also have this feeling that's not joy, and I don't understand what that is. um, Also, the understanding that when we give screenings, being able to make sure those screenings are given by individuals who can actually walk the person through not only understanding what the screening is saying, understanding that there is no negative outcome to the screening. So even if your screening says you need more help, it's not that we're going to take your baby away. We're just going to make sure you have the resources you need so that you can actually form the attachment with your child in a healthy and safe manner. And also understanding that that provider has the skills and resources to know what's beyond their means. So if you're a provider and what you work with is individuals who may have postpartum depression, anxiety, or OCD, but not someone with psychosis, you need to refer out. If you're someone that doesn't know anything about perinatal or postpartum OCD, you should refer out. And being okay and confident, even as a provider, with saying this is beyond my scope, because it's not about you as a provider, but making sure that that parent is able to do and be there for their child and their family. And something that I tell people all the time, it's about putting yourself first. So even as a provider, making sure that we are helping the individual understand it's about you becoming healthy so that you can then be there for others. But others aren't your why. Your why is you. Sorry, I feel like I've said a lot.
Val, if I can jump in, one of the things that I was really troubled by was um, Julie's unwillingness to take medication while she was pregnant and breastfeeding. And I had thought that, I know for me, um, it was really important for me to be healthy so that I could be a mom. And that was and we researched like what would be an okay medicine to take and all that. But I felt like that was, I felt like she was struggling with a choice that didn't necessarily have to be a choice. So I'm wondering, because I was pregnant a long time ago, um, uh, can it be safe to be taking antidepressants and be pregnant and breastfeeding? And I know I don't remember. I don't know if you're a prescriber, but
So I'm not a prescriber, but what we tell, when I say we, what we learn in training, but also what I put into practice. This is why it's important for us to have, for our clients to have what we call a um, interdisciplinary team, like a full healthcare team made up of all their providers that they will be with along the way. And for me to be able to have a relationship with those providers as well, because that's a conversation between me and the OB and me, maybe the psychiatrist who may be prescribing that medication, to be able to help know, dosage as well as the type. Because I think that those are the two key things there: dosage and type. Depend on if you're able to continue to take them during pregnancy, as well as during breastfeeding, or if you're getting weaned off. And it's not for me to know dosage and type so that I can monitor, as much as it is when you start to tell me things that you're feeling. I know to say, hey, I need you to report this back to your doctor, because it sounds like maybe we need to check in with the medication, or you need to check in with your doctor because maybe there needs to be an addition of medication.
um, and I also didn't get the sense that there was a lot of therapy going on in this movie. I mean, she did have some relationship with the psychiatrist. I don't generally think of psychiatrists as doing therapy necessarily that well, and they don't really have time for it anyway, the way that our system is currently structured. And I really thought that there must have been some therapy that could have been helpful for her and for her and her husband together.
I felt the same way in watching. Sorry, Shamika. That there were hints. If you watch the movie carefully, if you saw in that, kind of the second half of the movie, there were obvious hints that she was not doing well, no matter how much she was saying she wanted to do well. And her husband, as observant as he tried to be, had all of his anxieties kind of riding on him, and his approach was just to be like, "Are you okay? Are you okay? Are you okay? Are you okay?" And there were things that he may have noticed were not, that she was not 100% well, but a professional, a therapist, may have been able to intervene. So if she had been receiving regular therapy, perhaps that second really serious bout with, and also knowing that she, as somebody who had already attempted, was at such a high risk for attempting again. I gotta think, and we're talking about fictional characters, but this happens in real life. That it could have been caught. There could have been another intervention. So I'm sorry, Shamika. I think that kind of brings us into another question. So the husband, played by Ethan, he displayed a wide range of emotions and reactions to his wife's postpartum depression, her second pregnancy, and also her attempt. And you see that with his character. He has a sister in the movie who has a lot of anger toward the sister. Finds Julie after her first attempt, and the sister was there with her child as well, and so she had anger about that suicide attempt, and she was saying things like, did you think about me? Did you think how it would be for me and my small child to find you like that? And talked about her being selfish. These are not uncommon feelings that family members can feel about a person who has made a suicide attempt, although we as an organization always try to help people understand that somebody who's at the point of wanting to take their life is at their lowest point. They think the world is better without them. They think that they are doing nothing but harming their family. And so that anger, while all the feelings are understandable, what needs to be behind it is some understanding of postpartum or any other kind of depression, and where the people are when they are that down and thinking about taking their lives. So just those range of emotions from the husband, from his anxiety to his compassion to his family's anger, how do you all feel about that in terms of a representation of how family members can feel about a loved one who's either dealing with postpartum depression or who has made a suicide attempt?
So one of the things I was going to say is that's one of the reasons why I say it's very important for us as providers to make sure we know what the client support system looks like. Being able to, even me being a licensed marriage and family therapist who specializes in perinatal mental health, being able to bring the family in, make sure families are a part of safety plans, because a part of that comes with psychoeducation, not just this understanding that this person creates a plan or is having, thoughts, that you will be the person to call and help admit them, or you'll be the person to be able to identify some of the key factors they've stated are their trigger points, but also to understand what emotions you have, and that what is happening here, what everyone is like, the way this all intersects, it's still very individualized. Your anger is based on the place that you'll be put in if this person is no longer here. Anger is also that grief that bubbles up, but also maybe some of that guilt that you weren't able to stop this from happening, but not being able to place that on the person because, as you stated, this person is in a place where they feel like the world is better without them. So what are the things that we're telling them throughout this journey that lets them know that we're here, we support them, versus some of the messaging that we often get, which is, you got this, you were made for this, you were created for this. There are times for those messages. When a person is in the depth of darkness, though, is not it. Those are the times when we need to be saying things like, I may not understand what you're going through, but I'm not leaving your side. I may have a small child, so I may be like, hey, I have a baby and I get it, but we can't just leave our children. No, then that's, maybe we need to have a play date with our kids so that you're not feeling as though you're alone with your child. And yeah, it's twice the screaming babies, but it's also 2 times the adults. Like, being able to change those narratives, and also be able to incorporate things like, for instance, I know you all were talking about the poems. Bibliotherapy is actually one of the techniques used for PMADs. So being able to present books and literature to someone so that it externalizes that what I'm feeling is not me, it's a thing, but I am not it. And being able to see that in literature, poems, and other things, and use that to help as you walk through what you're seeing someone else go through, actually visualize some actual solutions for yourself.
I thought it was
Now I
really
feel bad about criticizing the poems. Go ahead, Susan.
Oh, the poem that was written by Sylvia Plath not long before she took her own life. There you go. That I thought that it was a really clever thing to include the sister. The scene where they were in the bar and she was there with her husband, I assume, and it was Julie's husband, Ethan's sister, who had found Julie, and she was angry. And the way that her husband was trying to shush her up, and I mean, it wasn't the time or place, and it would have been good if there were like a referee kind of person, like someone to help them work through it, as opposed to just accusation. And but I thought it was smart. I thought it was smart to put in the kinds of reactions that people may have, and for some people, it might evoke sympathy for her. And for some people, it might evoke this sense that she has no sensitivity at all. But I mean, that's the thing. You can have multiple emotions existing in the same space. And and she needed support too, for sure. I mean, that's traumatic. There's no doubt about it. And she was also trying to be protective of her brother, and so I thought that was an important thing, and I think, I thought that it was brave of Ethan to actually say as much as he did about his own feelings, and it was, a little bit here and a little bit there, but you could see that he was trying to be more honest as their relationship developed.
He was definitely the best of the three husbands out of the three movies we're going to talk about. He was the most plugged in and the most proactive. So I think that was good to see. But unfortunately, that leads me to my next thing that I want to point out, and then we have to move on to our other movies. The film sadly ends in the future, years after Julie's ultimate suicide. What do you think? Whenever I see movies like this, when it's well made, there's good acting, but the ending, it all leads up to her suicide. I'm like, well, what am I supposed to take away from this? What am I supposed to feel? Because I just ended up feeling sad. I can appreciate the movie for its accuracy and honesty in the portrayal of postpartum depression, of suicidal ideation, of what suicide can do to a family. But I just ultimately was just really sad and felt without hope, because she had a husband who cared, who was very invested. There was support, yet she did ultimately take her life. So what do you think the filmmakers want to get across with such a tragic ending? Why do movies like this exist? I know I go to movies and TV for an escape, and these kind of things really hit close to home. So what are we supposed to get from a movie like this with everything that happens, with how much Julie tried to and wanted to be well and wanted to be there for her family, but at the end she takes her life? What are we to do with a movie like this? And for those who've just joined us, we are talking about A Mouthful of Air, the movie A Mouthful of Air.
I mean, we'd like to think that suicide is always preventable, but it isn't. And I think that they're just giving us a reality that this is what happens in some families. And I mean, I don't know how much she could really break away from her depression enough to feel invested in her family. I mean, she loved those children. I think she loved her husband, but I felt like there was always this curtain, or this, something that was in between her being able to make the connection. But even if you do, if your depression is such that you're thinking that your family's going to be better off without you, then I would hope that there were things that could be done, but I didn't feel like she was having great treatment anyway. So it's very conflicted for me.
Shamika, what are we to take away from a movie where you see a family, a person who is struggling, who ultimately takes their life? What's the good of a movie like this, if there is any good?
So I'm going to take kind of it's not really positive, but going the next step from what Susan said, which is it's the understanding that it impacts us all. Postpartum depression, anxiety, psychosis, women's mental health, our mental health in general. These are issues that impact us all. That was a fictional character, but a true story. Those characters may have been made up, but as Susan pointed out, that's someone's family. So this understanding that even when it's not us, the stories that are happening around us still impact us. And we're able to watch movies like this, learn from them, and hopefully walk away being able to highlight, we need better treatment plans. We need to be that. Like in that story, I want to be the person that's like a support person. I want to be the person helping to identify these are the questions that need to be asked. I want to be without taking on this burden of like, I have to be the person to stop this, but understand the importance of community. There are a lot of areas in that movie, family relationships and other things, where in all honesty, maybe just one other person like removed could have been the person to be like, yeah, I'm just far enough away for this to point out to you that you're being a jerk, or you should show it better as a father. Like, as a mother, maybe you shouldn't tell your daughter that when she's like trying to, be lean into you for comfort. It takes us all when it comes to suicide prevention, creating access within healthcare, and ensuring that the people that we love and care about are actually taking care of themselves. And so I think movies like this, yes, that's very grandiose, but as Susan pointed out, it's not for some people. That's their actual lived experience. So what are we doing for the people who are in our lives, who we do have access to? And not only that, a reminder that survivors need support systems, whether it's just a survivor of an attempt or the survivors of the person that attempted. Everyone is in need of support because this truly does impact all of us.
One thing that occurred to me, Val, is that there were people who were asking, "How are you?" or "Are you all right?" But they never asked, "How can I help?" And that just occurred to me when you were talking, Shamika.
Yep. Those are great takeaway points for us to have from the first Full of Air. If anyone who's watching has seen any of these movies or has any comments, please add your thoughts in the chat. We're going to move to the next movie, which is Tully. Stressed and struggling with a newborn, Marlo warily accepts the gift of a night nanny, Tully, who turns out to be more than just a mother's helper.
No, no, no.
Do you know what a night nanny is? They take care of the baby at night so mom and dad can get some sleep.
I don't want a stranger in my house. It's like a Lifetime movie where the nanny tries to kill the family and the mom survives and she has to walk with a cane at the end.
Get over yourself.
Mom, what's wrong with your body?
Hello. I'm Tully. I'm here to take care of you. I'm just not used to people doing things for me. I hold a baby all day, and then nighttime rolls around and I'm supposed to just switch gears, like, hello, all sexy now. You're empty. Yeah. No, you're empty on this side. Your 20s are great, but then your 30s come around the corner like a garbage truck at 5 a.m. Girls can't. No, we don't. We might look like we're all better, but if you look close, we're covered in concealer. You're convinced that you're this failure, but you actually made your biggest dream come true.
If you want to run off or something, I get that. Because I want to do that too sometimes, but I'm not gonna.
I'm here to help you with everything. You can't fix the parts without treating the whole. Yeah, no one's treated my whole in a really long time.
So this is another movie that I over-identified with a lot. So much of what what Marlo, the mom that Charlize Theron plays, is going through those initial days, especially after you've had multiple children, that exhaustion, that feeling that my body's not my own and it hasn't been for a long time, and just really struggling with those emotions. So and again, this is the movie Tully. If anybody's seen it, tell us what you thought about it in the comments. Like in A Mouthful of Air, Marlo, who gives birth to her third child shortly after the start of the film, has had a history of postpartum depression that first occurred after her second child. According to the National Institute of Mental Health, women are at increased risk for perinatal depression if they have a personal or family history of depression or bipolar disorder, or if they experience depression with a previous pregnancy. So Susan, I'd like to hear your thoughts on this film. Also, what advice would you have given to somebody like Marlo and her loved ones before the birth of her third child, knowing that she had experienced depression after the birth of her second child? Just give me your thoughts, and then Shamika, we're going to come to you.
This is not generalizable, maybe, but there were issues with her other children that needed to be dealt with, that certainly affected her mental health. But I mean, her son was dealing with some sort of undiagnosed mental health condition, and it was creating negative impacts for all of their lives. And, you know, I really would have encouraged that they try and get some answers. And she did eventually say that they had gone to 3 doctors, and just makes me feel like they went to 3 not very good doctors. And if they had been in a public school, there would have been more services available than what they were getting in this private school that was just like, you know, what was the word that they used? Quirky. He's quirky, and we can't give him that much attention. I think that she also didn't have a whole lot of support. So, you know, building up your circle would make a lot of sense. She had relatives that were not relatable. So I think that there were some lessons, some things that could have been said to the dad about being a bit more engaged, you know, like left the kids at home without a sitter. You know, this is the conversation that I had with a relative about, it's not babysitting when it's your own kids. You need to be responsible. And so I think, you know, and what it came down for her, I think, was that there was just no way for her to take care of herself. There was no space for her to take care of herself. And she needed that. I mean, everybody needs that. So I think that those are the kinds of things that I might pass along.
And Shamika, in your work, either as a therapist or your work as a doula, you work with birthing people, have you worked with moms who have had a pre-existing mental health condition who then are going to have their second, third, or however many, whatever number child? And if so, what are some of the things, what do you do that might be different with those patients or clients that you wouldn't necessarily be doing with others, and kind of how do you navigate that as a mental health professional and as a doula?
So one of the interesting things, and I don't think it's generalized either, Susan, is that for me specifically, for my clients that have multiple children, oftentimes it's not even immediately after the birth of their child. It may be at the first birthday. They start seeing me because they're ready to, like, and I hate to say the word admit, but they're ready to accept I may need some help. I've even had clients where before family members were the ones that were like, I know something is off. So they called to try to do the consultation, but that phone call open the door for someone to, to actually be able to have the conversation with the client. So that to say, having a supportive team, those are examples why it's very important, because even when you aren't ready to say, I need help, there are people who are saying, hey, I know this is not you. Like, we're going to keep working until you say, like, I'm ready to accept this. But also in those same cases, we're working on the postpartum depression, and then they may find out they're having a baby, most of the time unplanned. Susan, when you had asked about the medications, sometimes medications impact birth control. Sometimes there's also the fear around actually talking to the doctor leads to not talking to the doctor about anything, which also leads to lack of prevention or talking about things to do in what we call interconception, the period between having a baby and conceiving another baby, because it's like, what do I need to do to make sure the doctor can say I'm doing what I need to do? So check mark and get out. I don't want to have any conversations. I don't want to talk to you. Like, yes, this is what I'm doing and I'm leaving. So one of the big things there is, of course, making sure that they are, from the standpoint of things that you learn as a doula, what are some of the questions you should be having with your doctor? How are you advocating for yourself? What are your conversations looking like with the person who's taking you to the doctor? So a lot of people don't realize you can have an advocate with you in the room. If you don't have a partner who can go with you, you can request one even from your hospital or the doctor's office. So what are the questions and concerns that you have that even if you don't feel comfortable voicing them yourself, maybe you've written them down and this person's able to like kind of initiate that conversation for you. Being able to know the signs. So in postpartum depression, did you truly not feel what you're feeling until after the baby was born? Or are you coming to recognize that you were having, like, there were signs showing up during pregnancy that just exacerbated at the birth? And if that's the case with this next pregnancy, what are we looking for? What are some things that you're noticing that like did happen with your last pregnancy? Emphasis on the support system again, especially now that we have multiple children. What does caregiving look like? One of the activities that I do with my new moms is creating what we call our emergency emotional contact list. So kind of like your emergency contact list that you leave, you know, for the babysitter, you must know CPR, all these things. Here's the number to 911, the non-emergency number. Who are those people for you? Who do you contact when certain things are happening, because they're going to be able to provide for you in that moment the emotional support you need, just as well as who are you not calling? And for everyone that has a great relationship with their mom, this is not for you. This is just a common example that I often hear. Because of our family history and my mom's ideas, like, you can do this, you have to push through. We've always pushed through. So if that's, and I'm speaking in general, so if that's your mom's, you know, motto, when you're truly feeling down, like you need help or you're overwhelmed, is your mom the person to call, or do you need to call somebody else that has been through this and can gently tell you, hey, I understand, ask, what do you need? And know that the work that you're doing with your therapist or doing with your support system is helping you be able to identify what you actually need to be able to say what those needs are. And then also possibly just show up. Like, okay, hey, I'm gonna come do the dishes while you put on dinner, or I'm gonna come help with putting on a load of laundry while you're putting, you know, dishes in the dishwasher. And when you asked about a doula, one of the things that we're shifting to as well is not just holding baby showers, but what about nesting parties? Like inviting your friends and family over, those that you truly trust, because I believe your home is a sacred space, but into your home to help be the one to wash the baby clothes and fold them and put them in, you know, help set up the nursery. Things that we often hear like the thing you do alone, but it's like this big and joyous moment. Like, what if that's a way to relieve some of the pressures to have people come in and help? Doesn't mean they're taking away from you being able to put the creativity behind it and say what you want. It just means they're helping take the legwork off of you. So I think if I were to talk about like the big differences, it would be some of those, like understanding what are the milestones that we've been told are really big and they should be just for us, that may sometimes really overwhelm us, that we can actually include people in on. And that's a part of building our village and our support system.
I think that's really important. And the thing I liked that you said that people can take away from it is also when you're looking at building that support team, you need the cheerleader, you need the commiserator, you need the planner, you need the, you know, the cook, you need, I mean, as broad of a support network as you can build, the better. You need your religious, you know, your prayer warrior or your, you know, your synagogue partner. You need whatever that team looks like. So you have, you know, you have different people to go to for your needs. And hopefully they all have the knowledge of what the symptoms are and what they should do if they needed to intervene, but they're also can play different roles. One more question about this movie, then we have to move on to the last movie. So in the film Tully, Marla, who is overwhelmed, overtired, and emotionally depleted, gets help and finds herself again thanks to her night nurse. The night nurse, Tully, doesn't just help her with her newborn, she provides love and acceptance to Marlo. The big twist in the film, if you haven't seen this is like a 5-year-old spoiler alert, is that Tully is just a manifestation of Marlo's 26-year-old self. she's a hallucination. She's not actually there. So, Shamika, can you talk a little bit about postpartum psychosis before we move on to the next film? Because ultimately, Marla wasn't really doing better. She was hallucinating a younger version of herself. She was staying up late at night and baking cupcakes and cleaning the whole house. She was extremely sleep deprived, and that caused her to hallucinate this night nurse who was really a manifestation of her own self. So, can you talk a little bit about postpartum psychosis?
Yes. So I think I think it's great we transitioned between both these movies the way we did, because I feel PMAs get dumped into a bucket together, and we often don't realize, especially when it comes to how we take things from the media, some of those key differences. For instance, if all hallucinations or thoughts that occur with psychosis are not ones of harming yourself or harming your child. But when we like broadcast that in the media and we make that as that's a sign someone has psychosis and they must immediately get help and like tear them apart from their families, that's when we start to like literally carry on those negative and harmful messages that literally create the stigma that in the future create other individuals who are going through things that don't want to talk about it, because it's an understanding that literally if I say this, it's almost like a witch hunt, like people are trying to burn me at the stake, and that's not what we want to happen. Or people being like, I'm afraid of saying I'm having thoughts, or maybe I know this isn't baby blues because I don't want someone to misdiagnose me or diagnose me with this over this, because if I get this diagnosis and not this one, then the outcome is, I'm going to be ostracized. So then you have people literally trying to diagnose themselves so that they can present to you by possibly saying, I need help, but present with the symptoms that are going to give them a diagnosis they feel would be better approached or taken more easily by the people around them. And some of the other things with psychosis are outside of the delusions or strange beliefs and the hallucinations are feeling very irritable. And we don't talk enough about postpartum rage, but I know you asked me about psychosis, so I'm gonna stay here. Feeling very irritated, hyperactivity, depression or a flat affect. And I think a lot of times people also, depression, of course, is for a lot of people lack of motivation in the sense of hopelessness. But when you add in that flat affect, some people are like, oh, they're just a pessimist or they're a realist. All of us should be able to have moments of optimism at some given time. There should be something that brings us joy. But if nothing in life is bringing us joy, that's a clear, like physical manifestation of some things that we probably should, like others around us should be checking in on. Decreased need or inability to sleep. So insomnia, first of all, the newborn period where parents are not able to sleep because of the sleeping cycles of a newborn has often been compared to literally like how individuals like war criminals, like how they're treated during war, like when someone is being, there's a word for it, not hazing, but very similar to that. So but then there's also a difference between that lack of sleep and literally your body not allowing you to sleep at all. So another reason to be sure you're speaking with a professional to be able to know what those differences are, because to someone who may not have an understanding of PMAD, psychosis, or specifically the difference between baby blues, they may be like, oh, that's just common in the first, couple of months after having a baby. You're not going to sleep. So there's nothing wrong there. But if I'm literally not sleeping because I cannot sleep, so I'm finding other things to do, but you're like, oh, that means that you've like cracked the code in being a mom. Like you're just being productive when the baby sleep. Mm, that's not it at all. Like this is really a cry for help. Paranoia, suspiciousness, rapid mood swings, and then oftentimes difficulty communicating. And Postpartum Support International has a great like one pager on it. They also have resources that people can reach out to, different apps. And the understanding, I think another big thing to know about psychosis outside from the very general information that I gave, something that a lot of survivors want individuals to know is they may not actually have those violent thoughts. Like, the thought of harming themselves or harming family members was not something they experienced when they had postpartum psychosis, but something that we do know, and I think is very important, not only for family members to know, but caregivers as well as therapists. Postpartum psychosis requires a specialist and a professional. If your client is presenting with postpartum psychosis, please refer them to someone. It is something that can be treatable, but it is very important. The sooner you notice it, the better. So that hopefully this individual is able to get the treatment they need, and then better be able to form attachment with their child, be able to actually be not reintroduced, but like brought back into their family unit without that loss of time, and maybe having to recover from some of the things that happens when we've lost literally months or maybe even a year of that newborn or new mom experience, because it took so long to identify that this was actually postpartum psychosis.
I think the most important thing that you said there is that professionals are the ones to determine that actual diagnosis. And even if you are a mental health clinician, if you don't specialize in postpartum psychosis, then maybe that's something that you need to refer out to. And then, of course, family members should also be aware of the signs. We put up Postpartum Support International's website, which has a lot of resources that differentiate baby blues from postpartum depression, from postpartum psychosis, postpartum OCD, all of those different diagnoses. But for the sake of time, we're going to move on to our last film, The Lost Daughter. When a small, seemingly meaningless event occurs, Leda, a divorcee with 2 adult daughters, is overwhelmed by memories of the difficult, unconventional choices she made as a mother and their consequences for herself and her family. The seemingly serene tale of a woman's pleasant rediscovery of herself soon becomes the story of a ferocious confrontation with an unsettled past.
Miss Caruso, welcome.
Thank you.
Excuse me, I work at the beach house. Just let me know if you need anything.
Great.
Get up! Mommy, get up!
You don't have kids? Yes, I have 2 daughters. Hey, your mommy's big girl. You're my big girl. She's driving me crazy.
What were your daughters like when they were little?
I can't remember much, actually.
I saw you at the beach today.
I didn't see you.
I saw you.
The little girl lost her doll. She wouldn't stop crying.
Children are a crushing responsibility. Happy birthday.
Mama.
I'm working. I'm suffocating.
I'll give you 3 seconds to come back. 3, 2, 1.
Okay, so in a review for this film, writer Sean Burns pens the following. The Lost Daughter is such a fascinating film because it does not try to explain away its central character or justify her petty resentments. Oh, sorry. Like, um, it instead makes visceral the fears and shame of mothers who feel themselves unfit and the guilt that comes with wanting a little piece of your life that's all your own. For a childless person, the scenes of young Leda being overwhelmed by two daughters and postpartum depression could sometimes feel like a horror movie. So, Shamika, what do you think the writer and director Maggie Gyllenhaal was inviting viewers to consider with regard to motherhood, women's mental health, and our choices with this movie, The Lost Daughter?
Okay, I'm gonna try to keep it brief because of time. I think it's really bringing us into now in terms of being more open with sharing the not so positive images that come with motherhood, as well as this idea that everyone has a voice and their stories are worth telling, whether they are positive or negative, because no one person's motherhood journey is the same. So if I have fear, if I'm someone that I'm constantly um, disassociating other things, it doesn't mean that I'm less of a mother or that my motherhood journey is one that essentially shouldn't be regarded as a journey of being a mother. It just means that maybe, as Susan has pointed out several different times, my I had a lack of community, I had a lack of resources, I had a lack of people who could actually, you know, help me come back from the deep end. Whereas maybe someone who had a really perfect depiction of motherhood in the media on their social media timeline, behind the scenes they had a support system though that was able to help them navigate the same waters that I was navigating, but look different than how mine looked. Because I'm going to tell you, oftentimes that's the true difference. It's the support system that's like standing behind there. Like everyone has that one decision, one choice that made their story look different than someone else's. And I think, in all honesty, like that's what this movie was portraying. Like those instances where in a split second your story merged and looks different than someone else's, but it's because of that one choice that you made.
Susan, I'm going to come to you. After watching her career wane and her marriage crumble from distance and lack of attention, Leda leaves her young family to pursue her career and an illicit affair. She actually ends up abandoning her children. She says abandoning her children for 3 years before coming back, and ultimately does get divorced. What was your take on this character, Leda, played by Olivia Colman, and her relationship with those around her?
Well, when we meet her, she's very isolated from almost everybody. Her relationship with her now 23 and 25-year-old daughters is very, kind of distant and strained, but surprisingly there's a relationship at least. So that, was like a glimmer of hope, and they did make contact at the end too. But just, being put in such a strange situation for her during the present time of the movie, among all of these people who are incredibly narcissistic and well, disingenuous and scary, put her in this just really weird situation where she had to be so guarded, and I don't know, she was really difficult to unpack.
On that same note, if you look at the other two films, although the main character Marlo and Tully and the character Julie in A Mouthful of Air, although they were also complicated with complicated feelings, they were ultimately likable. You rooted for them, you had compassion for them. Leda is not that character. One main plot point is that a little girl loses a doll. She steals the doll, and even when she sees that they're looking for the doll, the child is distraught, is not getting over it, she keeps the doll until the last possible minute, and doesn't even really give it back because of compassion. She's just kind of caught and confesses more than anything else. So she's not a a typical likable protagonist. She's a bit of an anti-hero. What is a character like that within this setting when we're talking about motherhood, when we're talking about mental health, when we're talking about relationships with others? How do we place a character like Leda? How do we understand a character like Leda? And what does that tell us about maybe just womanhood in general, and who we are expected to be, and how that plays a role in our mental health?
As I stated, this movie did a great job of anything in its discomfort of showing that everyone has a motherhood story to tell, or every woman has a story. And Leda would not be on social media. She's not the one that's gonna have a lot of followers because we want to know what her recipe is, and making homemade baby food, or how to maintain, keeping your children happy while also, having a thriving relationship. Complete opposite of all those things. But Ledas still exists. Like, there are Ledas out there. There are also individuals just like her who also may be seeking help, though. Like, that's something I think we don't necessarily see in the film. Like, we know she has a successful career, all these things, but we don't know. I feel like that's the cool thing about movies. Like, for me, I like to guess, like, if this was my client, I feel like there may be things that are happening outside of this that aren't getting shown because we're seeing what's happening in the moment, and it may be being told from their viewpoint. We're only going to see the worst moments, or the like major big moments, because the way memory works, those are probably the things they remember. So they may, like, individuals in reality are possibly in therapy, and those are the moments they're like playing back, like, I could have did this better. Or, as Susan stated, if these individuals weren't around me, I could actually hear myself think like the thoughts that I need to think versus being in survival mode at all times. So, big thing, I think she does exist in many areas. She's just not someone that's being put in the forefront or highlighted, because our society wants us to see and depict motherhood as something that, of course, we all desire. Is something that is pleasurable, including even the birth process. And there's stories about that even. In order to, you know, there's a majority, and that majority story is told a lot more than those who are truly trying to depict their actual lived experiences.
Val, I'll just say that I think that there was this connection among them, and just, the choices might have been different, but they all were dealing with a sense of isolation and overwhelm. They all were dealing with how to live within these expectations of motherhood. And they were all dealing with crying babies and it was relentless, honestly. But I also thought that there was this theme that was unfortunate for all of them, that they could have gotten effective help potentially, and then their lives would have all been different.
I 100% agree. Another thing I want to point out is that they're also all middle to upper middle class white women. And I really struggled. I tried very hard in preparing for our discussion to find movies that depicted a range of experiences with motherhood and postpartum depression, or postpartum or perinatal mental health. And I couldn't find anything. The best places for that really are on TV. There have been some great, well-rounded representations of postpartum depression and women's maternal mental health in TV series and documentaries, but I could not find. If somebody knows of one, you can put it in the chat or email me later. How could you have not seen this? But that was that was a glaring, I think, misstep. So sending that out to all the filmmakers and screenwriters of the world, that women of color, women who are in lower economic status, they experience these issues too, and they don't have some of the resources that the women even in these movies had. And so those stories also need to be told. Any quick final messages for either of you as we wrap up our conversation?
I think that just as much as it's important, especially in Maternal Mental Health Month, as well as Mental Health Awareness Month, it is to highlight the importance of us, seeing professionals, understanding the importance of the roles that we play in our communities outside of being professionals. Being able to recognize how motherhood is a journey and it is important to be in community and be support systems to those, not just holding the baby, but also holding the mother. Also, organizations like PSI often have, free resources that if you know that there's going to be a new mom in your community, you can, not get enough information to become a professional with those free resources, but enough to be what we would call a first responder, someone that could help identify some of those signs and symptoms to be able to say, hey, I think you should reach out to get help. Be able to have some of the conversations and become a trusted individual for that person to be able to hear some of their concerns. And maybe you're the first person that they actually open up and say, hey, I am struggling and I do need help. As well as, I think the beautiful thing too among all three movies is this understanding that no one's motherhood journey is the same. So not to feel guilt or shame if yours doesn't look like what you're seeing in the media, or if it doesn't look like even what your mom and grandmas look like your journey will be very unique and individualized to you, but also knowing that there are people to support you on that very individualized journey as well.
And I would just say thank you so much for including me in this conversation. And the next time we do one of these, can we watch movies that aren't quite so heavy?
Oh, I'm with Susan on that.
We'll do round two. We'll do movies to uplift your mental health. So that'll be round two. Thank you, everybody, for watching. Visit familyaware.org for more resources from Families for Depression Awareness. And also, if you need help, crisis text, you can call 988 Postpartum Support International. We put their resources up as well. Thank you all for watching.